On this episode of the Ask Mike Reinold Show, we talk about rotator cuff repairs in younger people.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're here up in Boston, champion PT and performance, answering your questions. Anything you want to talk about, head to mikereinold.com and ask us some questions. Just click on that podcast link and you can find the form to fill out our form to send more questions. But anyway, we're here with Dave Tilley, Lenny McCreena, Dan Pope, Dewesh Podell, Mike Scuduto, Jonah Monlog, and Kevin Coughlin here answering your questions. Len, briefly, who do we have for students today?
Yeah, we got Kylie, Christian, Maddie, Steve, Preston, and Tyler.
That's pretty good. That was pretty good. We'll catch up for a month. I like that, or for a week.
Yeah, go see last week's episode, and you can get their full information.
Great people, beautiful people. So, all right, who do we have today asking the question? What's our question today?
All right, we have Brian from California. Lately, I've started to see more patients in their 40s and 50s that want to stay active opt for rotator cuff repair surgery when they have small tears. Many people on Instagram have stated that this isn't needed. What are your thoughts?
This is a real timely question. I thought this is a good one because I know we have at least a handful of them right now at Champion, like speaking, but you know, people in their 40s and 50s, small rotator cuff tears, obviously their shoulder hurts, or we wouldn't have found out. We wouldn't have like dug into this, right? But they want to stay active, right? There's a small crowd on Instagram that will shame you if you send them to the doctor, right? That would be bad. That would be evil. That would be negative for them, right? Putting thoughts in their head. And there's another group that, you know, that wouldn't, right? So I think the real question is like, you know, we've had some recent experiences here at Champion with this. What do you guys think, right? And then I'd actually be curious too, but, you know, I don't want to put Dan on the spot, but I was going to use Dan as an avatar and say, Dan, in 10 years, you got a small rotator cuff tear. Yeah, how many days a week you work out?
6. I like working out.
I mean, if there were 8 days, you would do it, right?
I might, yeah.
So, right. So Dan works out 6 days a week for how many decades? 2 decades now?
Oh, yeah.
Right?
Getting older now.
Yeah. And like, look, you know, you get family, you got, you know, recreation things you like to do, right? If 10 years from now, you know, you're in your upper 40s and you have a small tear and it's not responding to rehab, that sort of thing, or maybe it is responding to rehab, but just is becoming that cranky shoulder. What do you do, Dan?
Yeah, I think about this sometimes because I probably will have this issue at some point in my life, you know?
I didn't mean to
highlight
highlight you
MRI
for
at this
that
point,
reason.
so I don't know what is going on in there. Yeah, I would potentially consider getting surgery, right? I'm not really there right now, so I'm kind of sticking my head in the sand. I don't know. There's a long background to this. Do you want me to go into that, or?
Well, I mean, we could talk about some of the guys we've recently worked with and stuff, but I know these are things that you've researched. I know these are things that you look at. I know there are some very vague studies that talk about progression of tears and stuff. So I was just curious your perspective, but I think if you put it in the lens of what would you do if it was you, right? Like based on all the science, you know, I just think that's an interesting way to look at it. So
I would consider it, I'd say. Yeah, I would consider it, getting surgery. I'd probably wait till it was a little bit bigger. I don't know if I'd do it like a really small tear, but I think that's part of the problem is you don't really know. Like I've had a bunch of young folks in their 40s with a history of some shoulder pain, but they can still lift weights. Eventually they go to the doctor and they actually have massive cuff tears, fully retracted tears, and they don't look like they have massive retractive tears, right? They're lifting in the gym still. And that's odd, but that is the presentation I think you see with these 40-year-olds, right, who've been lifting their entire life. And they have shoulder pain, maybe chronic up and down over the course of time. They eventually go to the doctor, and lo and behold, they actually have much more than a
Right.
small or medium tear, right? Yeah, and that's an issue for sure. But it's not the question the patient had, I guess. The person here had.
Well, it's also tough for you, right? You're 10 years away from that. So
Mhm.
you still feel invincible. You still feel like, you know what I mean? I can get through that. That's a tough one, right? Your thought's interesting though. Like you probably wouldn't do it if it's small. You'd wait for it to be chronic degenerative and retracted. Makes sense.
Yeah, I wouldn't do that either. But
So here's our dilemma, and that's the point, right? Fix
mhm.
this thing when it's small, or wait for it to be retracted and actually have some issues. That's the part that stinks for this. So I don't know, Len, you want to start first? So I know Lenny and Mike will be some great examples here. We've both they've both gone through some recent people that I think fit this exact mold. I'd be curious to hear, like, with your patients, why they did choose surgery, what the doctor said, like, what your thoughts were, how they're doing, that sort of thing. So,
Right.
Len, you want to start first?
Yeah, I mean, Dan alluded to it a little, and I think you did too, that these do kind of get worse over time, usually. There's probably a small population that can survive. It's like anything else, like, maybe a third, you get the rule of thirds or something like that. You try to, but you try to place your patient in, certain buckets and see where they fit, and you get in their head, and you see what their pain is. Is their pain responding to rehab? Um, what's their function, what's going on with them personally, stress related, and then what the MRI show, like how big is the tear, where is the tear, and then you can give it a course of PT and try to build some strength, prehab, so to speak. But I think they do seem to get worse over time, and then you're dealing with potentially tissue that's not as good. And most of these people do elect for, at least that I've treated, do elect for surgery, and they do really well. I got a guy right now who, 50, early 50s, had kind of a small to medium sized tear, about a 2 centimeter tear, which means like supra and some of the infra. And he is doing amazing, like no pain, full motion, and back to, golf and an amazing lifestyle. He completely resolved all of his symptoms, and he is happy. And, that's what you want to see. Not the person that's kind of up and down, and you do a follow-up MRI and it shows a bigger tear. As you age, as the tear gets bigger, it's tougher to repair. I'm not advocating for everybody to have surgery. I'm certainly not the opposite of Dr. Instagram from the question, but there is a time and a place for somebody to go conservative and non-up. But you got to picking the patient appropriately and getting in their head. Oftentimes they will eventually have a surgery, and it might be good to catch it early when they're younger and better tissue quality. But again, it's going to be different for everybody, and you're part of the team. You're part of the team that is in their head trying to answer their questions, and is the timing right for them, family wise and personal wise and work wise. There's so many different variables to consider, but there are very good outcomes if people do have these surgeries.
Interesting thought based on what you just ended with right there is that I think that's another benefit we've seen with these people that have elected or are electing to have this type of surgery is that they're doing it when they want to do it. They're controlling
Right.
the narrative to an extent. And, we have one particular one now that's going to start rehabbing with Mike in, I don't know, about a month now, that's been planning this for 6 months, right? He's like, well, let me, I'm going to get as strong as I can. Let me get through the golf season, and, I'll tackle this when it's convenient for me. So that way I prevent it from becoming a problem and less convenient for me in the future, right? So that's another interesting part about, getting after it a little bit earlier is you can kind of control that a little bit. So yeah, Kev.
Yeah, I'll just say, having like talked to you guys about this, it's definitely something I've changed my mind on in the last few years. I think I would have got baited into the Instagram narrative about this is another sign of aging and it's a common thing and let's just rehab it. I think what you just said and what Lenny was saying about the timing and everything, it's a shared decision-making process with the patient. And, Dan and I talk about this, but it's our job is to give them the best information so they can make the best decision for them. So letting them know that, there is a chance that these types of small tears do progress. And say you have them on the eval and you're suspecting a tear. I think something I would do differently that I wouldn't have done in the past is maybe get them in with a surgeon to have a consult and get some baseline imaging and figure out what size this tear is and the surgeon's perspective on it and if they think they're a surgical candidate or not. So we're not totally missing the ball and ignoring the symptom and saying, let's just rehab this, you're going to get better. They need to know that this could progress because if they are someone like Dan who over the next, 40, 50 years wants to continue lifting and staying in good shape, we don't want to turn a small tear into a large tear, and then their chance of recovery from a surgery is a little worse. Their chance of re-tearing after surgery could be a little worse. So I think, just being upfront with them and trying to share all the information so they can make the best decision possible for them.
If you're a 55-year-old active person and you're faced with a decision where, if you avoid this, you might be less active in the future. I think a lot of people, I think that's what sways people is when you say that here. It's like, hey, this, you haven't even gotten to retirement yet, right? You're not even at that point yet. And you have a lot of things you want to do. Like, you got to be kind of careful with that a little bit. So good point, Kevin. I mean, and I think it's you made an excellent point here where it's different for each person and their activity level, and it's gonna change our mindset with that. So I like it. But Mike, your experience, you've gone through this now, get a couple under your belt, like, at this moment. Just be curious, like, what were their thought process? What was yours during that? What are your thoughts?
Yeah, for sure. I think this is a very interesting population, the 40 to 50-year-old with shoulder pain. I think one of the big determining factors is they start to have pain when they sleep, and it's disrupting their sleep. And that's one of the primary symptoms that I hear them complaining about. And then generally, these people are working full time, so they don't have a ton of time to enjoy the activities that they want to do, like, for example, golf. So then they go out on the golf course and their shoulder hurts, and it's very discouraging for them. So I would say, yes, we're seeing an increase in these surgeries in this population. And I'll just throw in a contrarian viewpoint. I think these are very difficult people to rehab. I think they don't always understand what is expected of them post-op. To be in a sling for 4 to 6 weeks, maybe they have young kids, they're helping out around the house. They're still trying to work full time. Maybe they're traveling for work. I think that these are people that we really need to educate about wearing the sling, using all of those post-op precautions. It seems like the surgery and the post-op rehab is always a little bit too slow for them. They want to do this quicker. They're like, hey, how can we speed this up? And it's really, that's really not the name of the game, especially in these smaller tears. They seem to get a little stiffer early on, and they seem to be a little bit more painful early on. That's something that I've heard from, surgeons as well, is that those smaller tears tend to be a little bit more painful when they go in and do a rotator cuff repair. So I think there's a lot of things that we need to talk to them beforehand to make sure that they're, psychologically ready to go through the rehab process, and that they, their family's prepared for this. Like, they're going to need some help. They're going to need rides to and from PT. They're not going to be able to drive for a certain period of time. So it is challenging. I think, a lot of times these people think that the recovery is going to be really smooth and easy, and shoulder surgery and rotator cuff repairs it's pretty difficult for the first 4 to 6 weeks and beyond. And when they're trying to get back into the things that they love, really trying to build out a gradual return to golf program is sometimes difficult. These people want to get back to it as soon as possible. They don't want to have a ton of restrictions. Not trying to throw anyone under the bus here, but I've found it to be, a challenging patient population to rehab.
Well, it comes back to the point, though, is that maybe these small arthroscopic ones, they don't hurt enough, right? They don't hurt enough. They don't get stiff enough, like those types of things, right? They're younger, they're healthier. And what we're doing is we're putting them on a rehab protocol probably built for 70-year-olds, in all honesty, right? So I think that's our real question is I don't think we were really thinking about 40 and 50-year-olds having small rotator cuff repairs back in the day. And I think a lot of physicians will treat them just like a 75-year-old with a large tear. So that's frustrating for the person too. So they're like, I don't need to go this slow. I'm not saying they need to go faster, but this is a different population. It's just something we're not used to, right? This is something becoming more common with society now, with people being more active and stuff. So It's interesting, and to Lenny's point, Lenny said it too. Like, I'm not advocating everybody get surgery either. I'm kind of being more devil's advocate for it here, but I would say I'd probably lean towards surgery more than not on most active people, right? But control the narrative. And I think that's probably what leads to success. So yeah, it's an interesting topic. I mean, I don't think there's a right or a wrong answer here. And what do we do in our shoes? It's like, well, whatever decision that the person comes up with, our job's to help them, right? So we'll help them maximize non-operatively as much as we can if that's what they want. That's fine. But it's also probably our job to jump in and say like, hey, like, this keeps recurring. Let's be careful. And I think just going back to what Kevin said, this is the part that I think ties it all together. When you send them to a physician right away, instead of just putting your head down, it's not that you're trying to get surgery right away, but having that baseline, or what I call it is like we're not going to rush into this, but let's start a relationship with a shoulder surgeon, right? And I think they get what I'm saying, right? But let's just start a relationship. So that way we can, if you do another MRI in a year and you see that it's retracting or it's getting bigger, that's going to probably influence your decision too, right? So it's something to kind of keep in mind. So anybody, Dan, did you have something else you wanted to throw in?
I think that's smart. I think one of the biggest issues we have with these cuff tears is that we don't really know when they're progressing, right? And the problem is if they get too out of hand, then your outcomes are going to be worse. And if it fully retracts, outcomes are probably, I shouldn't say they're bad, but the re-tear rate is high, even though people tend to do decent, even if it re-tears. But we don't want to get out of hand. So I will have my patients that have a rotator cuff tear or suspected rotator cuff tear, I'll send them to the doc. And you probably want to send them to a doc you trust who maybe is not going to cut right away, but tell the patient like what we're planning. He's like, we don't want this to get out of hand. And then I've had this happen to Champion several times. Someone comes back a year and a half later, my shoulder flared up. Okay, let's go to the doc and get it checked out. I think the problem is that MRI is expensive. I mean, I talked to Rob Mansky about this, and he has a few docs do ultrasound, which is really cool because you can actually kind of serial ultrasound that tendon year over year and see what's going on there, and it's not that expensive. If it's as technology you have access to, I think that's a great idea because the big problem is that we don't know when they're progressing, how fast they're progressing, right? If we have pain, maybe that correlates. If it's a worse tear or there's retraction or there's multiple tendons involved, we know those progress faster. Otherwise, we don't really know. So if you can establish a relationship with the doc and actually get some objective info, I think that really helps.
Awesome. Great stuff. Yeah, I agree 100%. Don't forget, we talk about how rotator cuff tears are oftentimes recurring, right? Like meaning they'll have a recurrent tear. Well, not so much in the small ones. Keep that in mind too, right? So outcomes after a small is often better here too. So again, just another factor to kind of throw in there. So great stuff, everybody. Great episode. I think that was awesome. Hopefully that helped, Brian. For everybody, you're going to start seeing more and more of these people if you haven't already. So this is how we handle it here. We don't push anybody in any direction, right? But we help guide them with like, hey, let's just make sure we're covering our bases. And I'll say like a couple of the people like that we've talked about today that we've sent to the doctor, I think we've been surprised. I know I was on the one that's about to come in a little bit on how the doctor was like, look, this isn't a rush, but like, you should do this, right? So that means like they see something in there that they don't like, right? So kind of keep that in mind, right? Sometimes they'll be like, let's keep an eye on it, and that sort of thing. But when they say that, then in my mind, I'm like, I'm glad we did this because they think this is going to get bigger quicker or something like that. I don't know, right? But again, we send them to good doctors that we trust that aren't abusing the system and looking to cut on everybody, like Dan said. So anyway, awesome stuff. Please keep subscribing to the podcast if you like listening to this and listening to the answers to our questions. Apple Podcast, Spotify, whatever you do, please review us, rate us, subscribe, whatever you do. And we'll see you on the next episode. Thanks so much.